Good morning, and thanks for attending. Today, I'm joined by Louise Gagne, Executive Director of Community Services, to provide an update on the local COVID-19 situation, and Andrea McClellan, Director of COVID-19 Immunization Strategy, who will speak about the vaccine rollout. First, I'd like to say Happy Nurses Week to all the nurses at our health unit and every nurse in our communities. This last year has been extremely challenging, and your hard work and dedication have really been invaluable, so thank you. Provincially, we're starting to see a decrease in the daily number of individuals who test positive for COVID-19. Hospitals and their hospitalizations of the sick patients and the number of people in ICU are also decreasing. For the first time in 5 weeks, Ontario's 7-day average is less than the 3,000 cases per day. Our health unit's case numbers still remain low compared to other areas of the province, but our trend continues upward while the provincial average decreases. As of Tuesday, May 11th, our 7-day rolling average was at 17.7 cases per 100,000, the highest case rate we've had since late February 2021. Until we're able to get everyone vaccinated, our only way to decrease the provincial numbers and local numbers is for everyone to follow public health measures. This is why I support a continued shutdown, as the quickest path for long-term reopening is not reopening too soon. Getting local and provincial numbers down will also be the quickest path to reopening schools. So let's do what we all know has to be done to keep one another safe. Hang in there a little longer and make this our last shutdown. With that, I'd like to now hand it over to Ms. Gagne to provide an update on our local COVID-19 situation.
Thanks, Dr. Chirico. In the last 7 days, we have had 27 new cases, bringing our total case count to 398, with 243 in the Nipissing district and 155 in the district of Parry Sound. As of this morning, we have 35 active cases, with 2 cases in hospital. There are also 19 active VOC cases. It is important that everyone continue to follow public health measures, even after receiving 1 or 2 doses, until more people have been fully vaccinated. We are just over a week away from the unofficial start to summer, the May long weekend. However, this does not mark the end to COVID-19. Although the province has not officially announced an extension of the stay-at-home order and the provincial shutdown, individuals are reminded that public health guidance must still be followed. These measures include remaining at home except for essential purposes, such as going to the grocery store or pharmacy, accessing healthcare services, including getting vaccinated, for outdoor exercise, or for work that cannot be done remotely. We should continue to physically distance, staying 2 meters from others who do not reside in your home or where you're living. And if you live alone, physically distancing from anyone outside your exclusive close contact home. We wish you to continue wearing a face covering indoors and outdoors as required, and whenever physical distancing is difficult. Washing or sanitizing your hands often, coughing and sneezing into your sleeve, avoiding touching your eyes, nose, or mouth, cleaning high-touch objects and surfaces often. We also want to remind the public that they should be traveling to their cottages and camps. They should not be traveling to their cottages and camps unless it is for essential reasons. Everyone should limit traveling outside their home to essential trips. With that, I will pass it back to Dr. Chirico.
Thank you, Ms. Gagne. Ms. McClellan, can you please provide an update on our vaccine rollout, please?
Thanks, Dr. Chirico. Good morning, everyone. As of this morning, we have provided 50,805 vaccinations in our district. 47.8% of those 18 years of age and older who are residents of our district have received at least 1 dose of the COVID-19 vaccine. As of this week, a number of new individuals have been added to the group of individuals eligible to receive their first dose of COVID-19 vaccine. These individuals with at-risk health, as outlined by the province, and individuals who fall in the group 2 cannot work from home category, again as outlined by the province. This morning, those born in 1981 and earlier were added to the list of those eligible to book an appointment. A shortened dose interval for the highest healthcare workers, including long-term care home and retirement home staff and essential caregivers, was announced this week. We are awaiting further direction from the ministry with respect to this particular announcement. There are still appointments available on Friday in North Bay, Saturday in Parry Sound and Mattawa, and Sunday in Sturgeon Falls at the clinics we are hosting. The priority for immunization remains on dose 1. The provincial goal is for 65% of eligible Ontarians to receive their first dose of COVID-19 vaccine by May the 30th. On Tuesday, the Ministry of Health announced a pause on the rollout of and administration of first doses of the AstraZeneca vaccine. At this time, we are awaiting further direction from the Ministry of Health with respect to the second dose for those individuals who've already received their first dose of AstraZeneca vaccine. We are anticipating further guidance from the ministry and will communicate to the public more information once it is available. Yesterday, we launched a new toll-free number at the health unit for anything related to COVID-19. People can now contact our COVID-19 call center at 1-844-478-1400. This number is for those who need help booking COVID-19 vaccine appointments, have questions about restrictions, wish to report complaints, or have school concerns related to COVID-19. The change to a dedicated COVID-19 line was made in an effort to improve the call experience and open phone lines for those trying to reach other departments in the health unit. Upgrades include no more drop calls in the queue, technology enhancements that will inform anticipated wait time, position in queue, and provide callback functionality. We are working to increase the number of staff working at the call center as well. While the number of people working the call center is increasing, I still encourage those who are able to book their online appointment to do so, as we want to ensure that our phone lines are kept open for those who have questions and those who are unable to book an online appointment. We've had instances of some people trying to book their second vaccine appointment early, and they end up canceling their original second appointment and then are unable to book a second appointment. We are currently working through the process for second doses, through the appointments, the process for second dose appointments with the ministry. Please do not cancel your pre-scheduled appointment. We are working on how individuals who do not have a second appointment can book one, and we'll share this information once it is confirmed. I also want to remind the public that you must continue to follow public health measures, no matter if you are fully or partially immunized. And with that, I'll hand things back over to Dr. Chirico.
Thanks, Ms. McClellan. So now we'll begin to answer your questions. So if you have questions, please type them into the Q&A at the top of the screen. Our moderator will read them aloud, and we'll try to cover off as many as we can. And when possible, please ensure your name is attached to the question. So Alex, if you could please read out the first.
Hi, so at this time we do invite the media to submit questions, as currently we do not have any submitted. Oh, our first one just came in. It is from Eric from CTV. Does the health unit know if there are how many local vaccination appointments have had to be cancelled or postponed due to province pausing the first dose of AstraZeneca? What happens now for those people who had their appointment booked but didn't get the vaccine? Do they rebook? I believe this one will go to Andrea.
Thanks for that question, Eric. The ministry has put a pause on the AstraZeneca vaccine for first doses at this point in time. I don't know how many doses that has impacted locally. It was my understanding that the majority of the doses available in pharmacies have been administered. So I'm not positive. We can certainly find that out. People who have received a first dose will receive further information as the ministry releases it with respect to second dose vaccines.
Thank you. We are just going to give it a couple seconds and see if there are any other media inquiries that come in. It seems that there are no additional media inquiries. Oh, we just had one from Stu from Bay Today. This one is directed towards Louise. It says, how does a return to the classroom fit into an extension?
Thanks, Stu. At this point in time, we're not aware of what the province is planning with respect to returning to in-person learning. And we actually don't have confirmation of whether the province will be extending the shutdown and stay-at-home order. Our schools can and will reopen once the province decides that the risk of spread within the schools is low. The best way to protect our school community is by ensuring a low transmission in the community overall. And we have to continue to take the appropriate public safety measures and stay at home to limit the spread of COVID-19 in order to allow for this.
Thank you. Our next question is directed towards Andrea. It comes from Greg from Moose FM. What happens if someone misses their second dose of the vaccine after getting their first?
Appointments can be booked. The time frame between doses is the minimum time frame between the first and second dose. And so if somebody misses the actual date that they had an appointment scheduled on or doesn't have an appointment scheduled, they can still schedule an appointment.
Thank you. Our next question is also directed to you. It was submitted anonymously. Has the health unit secured Memorial Gardens past July? And if not, where will vaccines be administered?
Hi, thanks for that question. No, we will not be securing the gardens past July, and currently we are in the process of investigating locations for where we will relocate the clinics to. And once we have that completed, determined, we'll be sure to share that information with the public.
Thank you. Our next question is for Dr. Chirko. It comes from Clark from Cogeco News. Good morning. The Canadian Pediatric Society recently released a report concerning the impact of restrictions on well-being of youth. One statistic shows that 70% of Ontario school-aged children report that a deterioration in their mental health. Can Dr. Chirko address this, please?
Yes, that's an important point to bring up, Clark, and thank you for that. Absolutely, it has had a significant impact on children, on everybody, but in particular with the needs that children have. We recognize that having the resources available to them is very, very important, and we work with our community partners to help to facilitate that. One of the biggest issues that they face is certainly not being able to be in school with in-person learning. And that is why we worked really hard throughout the entire pandemic to keep schools open. And when there was an option to whether or not Northern Ontario was going to keep schools open or close them down like it happened in Southern Ontario, because our case numbers were low, we advocated and were successful in keeping the schools open as well as with the measures that were in place, and the school boards were tremendous in collaborating and having everything that needed to be put in place, and we did not have any outbreaks in schools. At this time, we recognized the seriousness of what's occurring with the third wave, with the variants of concern, and the necessity to have the schools closed at this time. And we will certainly, with all the impacts that you talked about, we'll be trying to get the schools open when the risk is deemed to be as low as possible to do that.
Thank you. Our next question is directed towards Andrea. It comes from Sarah Cook from the Parry Sound North Star. Can the health unit speak to the vaccination of education workers? To your knowledge, how many education workers have been vaccinated, and does the pause on AstraZeneca impact the availability for education workers to get vaccinated in our area?
You're muted, Andrea.
Sorry about that. Thanks, Sarah. I can't speak to the number of people who have been educators who have been immunized at this point in time, but we can get that information to you. We can certainly pull that from our COVAX database that the immunizations are entered into. The pause on AstraZeneca, I don't believe it will have a large effect on the ability of educators to receive vaccine. We have plenty of appointments available in the clinics that we're hosting across the district in the upcoming days. I'm not aware of any concerns that have been raised about access to appointments for educators. So certainly we would encourage them to contact the health unit or go online and book their appointments through our clinics.
Thank you. Our next question is for Dr. Chirko. It comes from Jennifer from the Nugget. Numerous medical associations have called on the province to open up golf courses and recreational facilities. Has your stance changed?
Again, our focus really is to follow the directions of what the province has decided to do. And we know that there are very safe ways to exercise, to get outdoors, which is what we certainly encourage. While people may or may not agree with the decision, it has to do with not the activity itself. It has to do with the mobility factor, about encouraging people to be out, to be picking up people to go golfing, to do these other activities. That's the rationale behind it. It affects less than 10% of the population. I love to golf myself. I'd love to see it open, but it isn't. And our concern really now has to be on what's occurring in our healthcare system, the spread of the virus. We are just starting to have an impact with the restrictions in place. And I am happy to forego golfing when I see this occurring. And not that golfing is contributing significantly to it. I understand that. But it is everybody working together for the same goal, to only go out for essential reasons. And when you do go out to exercise, do it in a safe manner. People know what they need to do. People just need to use some good judgment on what has to happen. And we will continue to move in the proper direction that we're headed in. And the sooner we do that and get the numbers down and sustain it, then we can get out of the shutdown. And let's make this our last shutdown.
Thank you. Our next question is for Andrea. It comes from Stu from Bay Today. Have any adverse effects been reported in our district from AstraZeneca recipients?
We have had some adverse events reported. I can't confirm that they were for which vaccine they were for, but we will get that information and get that to you.
Thank you. Our next question is for Dr. Chirko. It comes from Jennifer from the Nugget. What will your recommendation be when the province decides to reopen? You've been vocal in saying that the colored framework isn't the best option in reducing the spread.
Yeah, thank you for that, Jennifer. And I think that we do really have to look at the evidence, look at what works, what doesn't work, and what approach needs to be taken. Those discussions are currently being had at the provincial level. I do believe that it should be a phased approach. It should occur slowly, and it should occur either provincially or at the very least in a regional manner, because we've found that when you have districts that are adjacent to each other or have different levels of restrictions. Human nature being human nature, people will travel from districts with high restriction to those with low restrictions, and that increases the risk of spread of the virus. So I think we all collectively need to look at it, and we need to put in measures that will make this the last shutdown that we have. And we need to do that slowly and at an appropriate time. And while it means a little bit more time to do that and more sacrifice in the long run, it'll be a far better situation. And if we do that, we won't see a resurgence. We won't see the need to have to go into another stay-at-home order and shutdown.
Thank you. Our next question is also for you, Dr. Chirico. It comes from Eric from CTV. Many officials and health experts expect this summer to be a one-dose summer. What does a one-dose summer look like in our region?
I'm not so sure I understand what you mean by a one-dose summer. Do you mean that a lot of second doses will not have been achieved at that point? Can you clarify for me, please?
I think they mean that we will see a lot of people with one dose throughout the summer and not a high, like we'll just be entering into the second dose wave.
Right. Okay. Now, thank you for that. I think that what we've learned is that the first dose is what our objective is, to get as many people immunized with the first dose, offering protection to a large number of people. It's not the full protection, but it is very, very good to provide protection against severe disease, hospitalizations, and death. We know that it's been very effective that way. So the next point to that would be, with people with one dose, do we think that all of the public health measures will be loosened? I don't believe so. I believe that, yes, we'll still have some measures in place. To what extent will really depend on how successful we are now in keeping the numbers down and moving in that direction so that they're low enough. And then as that happens, less public health restrictions would need to be implemented. So I do believe that, yes, with the one dose, we still certainly need to keep the public health measures and precautions in place until we can get people fully vaccinated and keep the numbers and cases down.
Thank you. And so currently we do not have any other questions submitted. So that will complete this week's press conference. Thank you for everyone who attended, and we will have the recording up online this afternoon, as well as we'll see you back next week at 10 a.m. Thank you.
Thank you.